Hi, everybody. Welcome to the Waiting Room Entertainment. And I'm glad to see you guys all again today. And we are going to get started. We have some great guests. And just for everybody that hasn't been tuning in lately, we are trying to get to 1,000 subscribers. So make sure you hit that like and subscribe button and comment underneath this video if because we love to talk to you guys. So Rod.
Hi, good morning, everybody. And again, welcome to another episode of the Waiting Room Entertainment. We're so lucky and honored to have two very special guests from the Healthcare Navigation Project. We have Ivy Braun, who's a certified nurse practitioner since 1996. I believe you specialize in pediatrics.
Correct.
She is licensed in Connecticut, New York, and Pennsylvania. She's also a board member and advisor to the Healthcare Navigation Project. And along with her, we have Lauren Kopsick. She's degreed in sociology and juvenile justice. She is the founder of this organization. She uses her passion to create this, the project, which has extensive leadership experience in management. She's worked with physician groups, consultations for Fortune 500 companies and law firms, marketing and planning. And of course, she has I know she's super honored and proud to have the very tough job of also being a mama to two boys with disabilities. So thank you, ladies, for joining us. We're very, very proud and happy to have you with us today. So the first question I'll give it to Lauren. Tell us a little bit about the Healthcare Navigation Project.
Well, thank you so much for having us, first of all. And I think it's serendipitous that we are meeting this week because this is our 1-year anniversary of being in existence. So,
wow, congratulations.
Believe it or not, thank you. On April 13th of last year, I called LegalZoom. I've been a business consultant for many years, but I've never started anything. It was very difficult, but I knew it had to be done. And so I called LegalZoom, and on the 18th, we were giving our 501c3 status as Parent It Forward. The curriculum I guess designed was copywritten in May. And then in September, we won an award called the CODY Award from the Charity Design Company. Mm-hmm. I say it was for the person that needed the most help. So we were chosen, but whatever. So they chose us, and with that changed our name to the Healthcare Navigation Project. And they brought us out on Thanksgiving in time for Giving Tuesday. Now, also serendipitous is, I've got to give them a plug, is they are now looking for this year's winner. So if anybody's listening in that has a nonprofit that believes that they should also get this $6,500 worth of in-kind donation that gave us that beautiful website you saw and everything else, please go on their website and apply, because it was life-changing for us. And that's, I guess, I don't know, does that tell you a little bit about us?
Yeah, it does. That's fantastic. That's really great that you're sharing that info. So I know, obviously, Lauren, you're the founder, so I know how you got involved. Ivy, how did you get involved with the organization? How did you find Lauren?
So Lauren and I have known each other for years, years and years. And so I am, as a nurse practitioner, and especially a nurse practitioner adolescents, understand that there's a gap when it comes to transitioning healthcare to adult services and adult care. There's not enough time in our day to kind of give the information that kids really need or teenagers really need to learn how to process their own stuff. Because as we all know, once you turn 18, everything becomes your issues and your problems, and there's not parents and guardians to deal with it. Lauren has lived the gap. So the Healthcare Navigation Project teaches you all about how to navigate your own healthcare. And when there's gaps in it, or whether you don't know about something, she's lived it. She's lived it with both of her kids, and she's lived it with helping other people. So through the years of talking, I've seen her help people learn if they've gotten diagnosed with a rare disease, how do you navigate that system? If you're a teenager, how do you do this? If you're going off to college, what does that mean? Now I get medications at home, my mom picks up. well, how do I get them at college? What happens? So we talked a lot. And when she said that she wanted to bring this to a program that's a nonprofit program, I was like, count me in, I'm on board, I'll help. You know, like we would have these side conversations where I'd be like, okay, well, this is what I see in the office, and this is what happens. And she'd be like, well, this is what I see as a mom. And during that time, my child has grown as a young teenager into an 18-year-old. And so I watched the process of what she knew or didn't know from her perspective. And so that's how Lauren and I kind of connected. So we've always, been connected.
Yeah, that's an amazing mission. That mission, I mean, talk about something that's been just absent. I don't think anyone's really realized until you're put in that position how empty of a void that is and trying to get simple information. So I know that you both have put together some curriculum, and there's different categories: basic healthcare navigation, navigating specialty healthcare. And now all of these, and of course there's more, all of them are designed to, I guess, inform and also help. I know you're focusing on youth education, or teaching them how to, in a sense, kind of advocate for themselves as well. But this also is a good tool for caregivers and parents as well, correct?
Yes. So really our mission, I put together a universal immersive program that's independent, because I'm a mom. So I don't have to go by HIPAA stuff, right? I'm a mom sharing stories from myself and others that I've learned during the time. And the whole purpose for us is to give everyone, the patient, which is the child, or every child actually, whether they're underserved, overserved, whatever, the families and the caregivers, the tools so that they can manage their own health and care. And we're looking to develop here a lifetime of communication and research skills, because that's the only way you're going to be able to navigate the healthcare system, because there's no actual rules of engagement. You just need to understand how to think in a different way than you normally think. So the whole program is based on expanding your thinking skills, or critical thinking, which is what the World Health Organization says that you need for global mental health, is the 3 categories of the life skills that we work with. And then the other piece is health literacy, which the CDC, and those who didn't know what that was now do know what that is. They changed their whole definition of what they believe healthy people look like. They changed the definitions from 2000 to 2010, and now in 2020 changed it again to be, they want you to actually be able to use your healthcare and to be able to use it enough to be able to make well-informed decisions. And if that's done, and everyone in the world is able to do it too, that's when we have health equity. And that's written right in here. Okay. And then they have a whole other one for organizations that they've added in. We were talking a little bit about corporations earlier. Now that the new edict is, as a corporation, you are also responsible for health and wellness of your employees. So this program kind of works with all of that. And I'm done with my preaching for now.
Well, I think that's amazing, because I'm a mom too, and I have a child that has developmental disabilities, and it's been like a nightmare trying to navigate the system. It's so amazing that you're making something like this. Are you working with the schools also while you're doing this, and kind of building to help other parents?
Right now, we're working actually in this program called PTech, which is, I guess, a global high school program that it's done by lottery. And the one that we're working with is actually in the Norwalk High school system. And it's a private public partnership between IBM, Norwalk Community College, and the Norwalk, Connecticut school system. And these kids are going through our modules, and it's just been amazing to watch. This coming week, we have 5 modules, right? So first one is basic healthcare navigation, and then we have your mental health toolbox. And then the third one is Let's Talk Pharmacy. And I'm so excited about that one. That's the one that we're going to be doing with them. Got put off because it was picture day, and then it was something
break.
else. Yeah, that and that and that. So we're doing that this week with them. And we're also this evening out in LA, there's a group of National Honor Society students. It turns out that this year they've added education and healthcare or anything like that for the students would also count towards their community service. So they've signed up. I'm doing 2 with them. Tonight we're doing basic healthcare, and tomorrow we're going to do the mental health module with that group. So yeah, very excited about working with the schools. But we also work with others. We're actually going to be at Rare Fair. I don't know if you guys will be there.
No, I have never heard of Rare Fair. What's Rare Fair?
Well, Rare Fair is I guess an international, you would love it. It's for rare disease families all over the world. It's it's sponsored this year by the Rare Revolution and Rare Youth Revolution, and also the Dash Alliance. And it's going to be in Research Triangle Park at the hotel that's just opening up. Whatever one is just opening, and that's in September. And we will have our first booth, and we were also invited to do a breakout. So we have an hour breakout session that last year was attended by 1,900 people virtually globally. So really, really excited because we're going to be talking about the 5 principles of navigating the healthcare system. That's basically what we're going to do.
And I just want to add, just as you were talking about, we focus on teens and adolescents, but as Lauren and I talk, we're always like, well, yeah, there's caregiver information we want to give. There's parenting information, just a child that has a rare disease that may not be able to navigate for themselves. There is, Lauren and I start talking, and I'm like, well, my mom is now going through, an elderly person with Parkinson's, and I have to navigate a whole new system for her that I know nothing about. And so we keep saying, well, we could just individualize this to any group of people that comes to us. We'll take on, because the reality is, it doesn't matter what disease you have or what the illness is. It's how do you navigate a system, and how do you learn all the critical skills that Lauren was talking about to navigate the system. So we're open, and like, if your viewers are from whatever grouping they're from, if they want to reach out to us, we are happy to create a program or a curriculum that is specific for them, because the reality is each process it can be similar, right? So, when you're talking about schools, Lauren and I keep saying, oh, well, maybe we'll go to the PTA, because to talk to the parents about the basic healthcare principles, that's information building to anybody. It doesn't matter what their child has. And so it could be used towards, a well child that's turning 18. It could be used with a 10-year-old that you're not understanding step therapy. So these are we love the fact that we're a very global program.
Can I say something? The whole reason for this is so you learn before you need it, and not after, when it's too late. So I'd rather everyone not be sick. Like, it's before you're diagnosed, because once you're diagnosed, it's like you're in a parallel universe already, in sleeping chairs, and the changing of the guards, 7. You know what I'm saying? There's this whole block of time, 2 times a day, that you might as well not even bother. So it's this whole other life. So if you know before you get involved with it, then you know what you do, or there never is that emergency, especially with the mental health piece. If you know what to do and who to call before it becomes that crisis. So that's the reason why we exist. And also to
Yep.
help once it happens, obviously.
Yes, I'm so glad you brought that up because that's exactly true. It's there's nothing more, and as a caregiver, there's nothing more frustrating and scary than finding yourself in a situation like when my sister got diagnosed with scleroderma, which is a rare disease, and suddenly feeling beyond helpless. So what you're all doing, educating everybody, informing everyone, getting everybody to understand and realize that now is the time to try and learn and actually have some source to go to just in the event, just in case. Now is the time to build your knowledge. I mean, that's really, really awesome. So for our followers, just to let you all know, go to the healthcarenavigationproject.org. That's the site if you want to learn more information of this organization and also to participate. So Ivy, is this a good place for anyone to start if they want to get involved? Is there several avenues, or how can people help and contribute to what you both are building here?
So I think that, yes, our website, it has come to our website, read about what we have, read about what you want to learn about, but also we have opportunity to fill out forms, I guess you want to call it, submit your information, tell us what you either have to offer or what you're looking for and what you're interested in, because we can either give you information or teach you how to provide information, or maybe you have information that you can provide to us that we didn't know. Like Lauren, along her way of working with her sons, learned about step therapy. That's how it came to be. So maybe there's people out there that have information that we might not know. So we're always happy to gain more information. And Lauren can speak to the fact that her initial vision was about, why it was called Parent It Forward was because she was going to train parents and they were going to train other parents and other parents. So if there are parents or people or persons or siblings who want to get involved to eventually become trainers across the country, across the world, that's what we're ultimately looking to do. That Lauren and I and whoever else is involved with our team isn't the ones that are going out there to train people. That scleroderma organization is going to have somebody within their organization to say, hey, these are all the things, or we're going to go out and talk to other people, or you get a friend that says, oh my God, I'm feeling overwhelmed because I don't know what's going on in our life and I need help with this. And you're like, okay, well, I know that because I was taught that by the Navigation Project, and let me teach you,
Right. That was good that you brought that up. Our model is train the trainer. So the idea is we leave behind how to do this so that you can, because I call it 6 degrees of separation. It's the only way we're all going to learn in any time frame that we need, because we spoke before we went on air about algorithms and that, telehealth and telehospitals and all the things that I'm always involved in these meetings for is going to eventually lock out people that haven't snuck in. So that's what we're hoping to do, is get us all in and grandfathered so we know people, because that's the key. You need a person that you can call on the inside. Otherwise, you're speaking to artificial intelligence. And that's not for anybody, but never mind somebody that is a caregiver or has some sort of a rare disease or any illness.
Exactly, like a genuine resource, an actual person. So
Mhm.
do you all have support groups that have formed kind of throughout the United States or anything like that? Are you leading support groups?
Well, we are we're starting a revolution. So it begins with the people that we're working with, and we're hoping to balloon out. We have a lot of projects in place going forward, and we're hoping there'll be more and more and more. And of course, donations. will help us get to where we need to be. And
We
Go ahead.
also have the ability to do this virtually. So if, let's say you guys have a group that wants to have us come to speak, we're happy to do that. And then I think eventually, yeah, our goal and our role will be to have open sessions where we're offering, I mean, if we have 10 people that want to sign up for the same time, then we can offer a group. We want to do it more as a curriculum than a support group, I think, because I think there's so much to learn and talk about. But then when those people partake, then like what Lauren has done, like with each module, every time we go back to a new module, we regroup on what the kids have learned the last time and what have they done during that time. So in essence, we're a support group within the program, right? Because
Yeah.
we answer their questions, we address their stuff, but people can always email and reach out to us at the website, and we're happy to answer any questions directly.
Yeah. One thing you probably do want to know is it's a program where you leave with the information in here. There's no workbook, there's no homework. Homework would be things like people watching. You know, if you want to understand how to do better in communication and nonverbal communication, go people watch. Try to figure out I mean, it's kind of fun actually, right? So, and it's worthwhile because if you understand people, then that's the first step to being able to advocate for yourself, to understand people are people.
And I just want to clarify, it is for adults and children, right?
Yes.
Okay, and that sounds like something that, because like we were talking about, we host social clubs. That sounds like something that I could see even our social clubs wanting to learn how to navigate the system better. I mean, it's absolutely amazing. And the fact you guys have modules that can help them to learn. That's really amazing. I really love that.
Thank you. We'd
Yeah,
be happy to. Just invite us.
and please share your website for us.
Yeah, and the easiest way you could write the healthcarenavigationproject.org or just our initials, which is THNP.org. That gets you there too. Or Parent It Forward. Anything you want to write, basically .org will get you to us. I'm just teasing. But yes. And we will share a blurb like we talked about.
Okay. So I guess one last question. We're getting close to the end here. Wanted to ask both of you actually. So in the future, what would you like to see improve for young adults, patients moving into adulthood?
Can I answer? You want to answer that, or you want me to answer? You go first.
Well, I believe, there's 5, and they're the principles of advocating or navigating the healthcare system. And that is, people are people. Don't stop until it makes sense. Don't give up anything because you'll never, ever, ever, ever get it back. Try to work from the top, bottom, and outside in. And you could do the last one, my favorite. Go ahead.
Research. Right. Okay. I was research. I thought you were going to say, and don't stop until it makes sense to you.
Right.
That's
and
her
that too. I'm sorry,
Right,
I didn't give you a test at the last minute.
Lauren's line is always like, if it doesn't make sense to you, say it how you say it, because you say it so well.
If it doesn't make sense, if it doesn't make sense to you, it probably doesn't make sense. And you don't stop until it makes sense to you. And that's and because of people are people. That's why people are people has to go first. And we know what that means, us people in this room, right?
And for me, what I think is our goal is we want everybody to just have the information and the access to this, that when you, excuse me, as a person, whatever age you are, you walk into your doctor's appointment, you know everything you need to know to access the information that you need.
And not how to fill out forms. We're going to teach you how to get somebody else to fill out forms with you who knows how to fill out forms. Why do you need to be, have a degree in filling out forms? That's a waste of time. So that's the first principle. We get other people to help us. That's the whole point of this. Who can you get to with the trusted information that can at least get you to the next step if they can't get you all the way there? And that's what this whole thing is about. Access to the information that you and I know and know, why is it that we know and other people don't know? And that's not fair. So we're trying to make everything fair.
And you had said that you guys would like support. What opportunities? Because I'm all about galas. Everybody knows that. What opportunities do you guys have in place that where people can donate or help you guys out or come? What do you guys do for that? Like, do you have an event that you take every year or?
Well,
Not yet. At this point, it's just more donations at our website. Like, I think we're so proud of the fact that we're now in our first year, and I think we're learning how to grow ourselves from that perspective. We worked on a lot of back and forth developing the curriculum to make it what we thought was the most important and the best way to project information that was so user friendly for the people that were learning the information. And so like this YouTube video, like we want, or the podcast, we want people to feel casual and comfortable in the information once they learn it. But right now, donations are straight through the website.
Yeah, right now, to be perfectly transparent, I've been bootstrapping. I learned that word, but I've been a small business consultant for many years, so I know what it's like to work with no budget. So I've been able to do it. We've gotten a lot of in-kind donations through the Taproot Foundation. I have wonderful skilled volunteers that have all signed on that want to be with us for the long run. But if you know anybody that's interested in sponsoring our booth at the Rare Fair, where there'll be at least 1,900 people virtually and then a bunch of people on the ground, that would be awesome.
And they can reach out to you using the link below below this video. And that's amazing.
Thank you.
Thank you
for having us.
Rod?
Okay, so thank you very much for our special guests, Lauren Kopsick and Ivy Braun for the Healthcare Navigation Project. I just want to remind everyone to like, share, subscribe to our YouTube channel and social media. This has been a product of the Waiting Room Entertainment. On behalf of our team, we'd like to thank you all for your support and watching. Demi, was there something that you wanted to close with real quick?
Yes, so we have some exciting things coming up, and from now on moving forward, we're going to share events coming up. And so we want to start off by talking about the SRF, which is the Scleroderma Research Foundation. They have an event coming up June 1st. It's going to start at 9 a.m. And it is collaborating for the cure. It will be discussing all of the latest research for scleroderma, and I'm looking forward to it. I go every year. We will also provide that link below. Make sure you sign in and check out and get registered early. And again, it starts June 1st.
All right, thanks again, everybody, for watching. Again, for our special guests, they are at the healthcarenavigationproject.org. Please go visit that website, learn more about what they do, and definitely contribute your time. It's so worth it, as you heard. So thank you, ladies. Thank you very much. And
Thank
good to
you.
see everybody.
Thank you.
See you next episode.